The name of a person is the lifetime business of a person. So the name of Dr. Reem Osman is associated in Saudi Arabia, United Arab Emirates, Pakistan, and other Gulf countries with the high-end quality hospitals. Dr. Reem, thank you for hosting us. I think white flowers will be neutral and you will love it.
Thank you very much.
Dr. Reem, good afternoon.
Good afternoon.
And thank you so much for hosting us at Saudi German Hospital.
Thank you.
You know, all the patients, when they enter the lobby of the hospital, they see the surah from Quran.
Yeah.
Could you please give us an explanation why particularly this surah you have chosen for the hospital?
The surah from the Holy Quran, بسم الله الرحمن الرحيم ومن أحياها فكأنما أحيا الناس جميعا, meaning and whomever saved a life is like he saved the whole mankind. Actually, it's our motto for every day. It's our motto for our work. It's the passion that we all work for. Doctors, nurses, admins, during pandemic time, during emergency, during trauma cases, during complicated cases, always our medical team remember this surah because they see it every day and they know that this is the principle we work upon and this is how we help our patients and how we save the life, and this is how the satisfaction that we get it from all the work that we do, because we remember that by saving one life, it's like you are saving the whole mankind. Saudi German Hospital Dubai is a part of a big group, Saudi German Hospital Group, which was founded and established in Saudi Arabia, first hospital in Jeddah in 1988. So it's 35 years old group. SGH Dubai here, it was established and opened in 2012. And after that, we expanded into many other hospitals in United Emirates. We have in Sharjah, we have in Ajman, we have many satellite clinics. And the group itself also is expanding in Saudi Arabia with 7 currently operational hospital in all the cities of Saudi Arabia, in Egypt, in Cairo and Alexandria, and in new operation and Morocco and in Pakistan, inshallah. So it's one of the biggest groups in the Middle East, founded by Saudi family and operating in many countries all over the Middle East.
Dr. Reem, it's very interesting. Why have you decided to join particularly Saudi German Hospital?
I am a doctor by profession. I am eye surgeon, and I joined the group as an eye doctor, practicing in my own clinic. And you know, after a while, you just decide to explore a new area in your career. So I did the MBA, Master of Business Administration, and then I shifted from practicing medicine into healthcare management and moved to the CEO position, of course, by promotion. And I'm here, and I found my passion. I always tell them that you'll find your passion in different stages of your life.
In what ways do you plan to enhance the services in the hospital?
Now, healthcare in general is coming into more subspecialty and actually exceeding to the supra-subspecialty. So now with the opening Saudi German Hospital Dubai, as you know, we are going into the medical city concept. It's not a hospital anymore. It's a general hospital. With the new expansion, we have the Women and Children Hospital, the Orthopedic and Rehab Hospital, and we are planning for extra expansion for the coming 10 years. So this project is not one project and finish. It has another different expansion plan. So that's part of our strategy for the hospital, to go into the subspecialty and the ultra subspecialty, and the doctors per department, that every doctor, this doctor responsible for every part of the body. We don't have the concept anymore of the general specialty, that doctor who can see everything. We are encouraging the subspecialty concept in the hospital and the accreditation center of excellence center of the hospital. So we are working now with the accreditation, international accreditation bodies all over the world to accredit all our center of excellence with international certificate. The other part that we are working in is the technology part, of course. So now currently with all the technology becoming an important part of our life, it is also an important part in our medical practice, whether going into the robotic surgery, whether going into the AI, artificial intelligence, and all is part. All of them both will help in serving the patient better, better diagnosis, faster surgery, and faster healing process and recovery process.
Dr. Reem, could you please brief us about the specialties in the hospital?
So as I told you now, Saudi German Hospital Dubai is a healthcare city now. Where we are now, the General Hospital. The General Hospital will cover the adult medical management mainly. So we have the gastric center, gastroenterology center, cardiovascular center, neuroscience center, derma center, skin center, ENT center, ENT which is ear, nose, ophthalmology center, dental center. So in all these special urology center and kidney center. So we have with the cardiovascular center, let me explain to you more in details. In the cardiovascular center, or in a nutshell, in the hospital we cover from 0 till 100. Any disease is covered in the hospital as medical management or surgical management. And this is what's always our vision for the hospital. It's a one-stop shop for all your medical needs. So we have the cardiovascular center for cardiology, for vascular surgery, for interventional cardiology, and open heart surgery. We have the cancer center, which is also holistic center, from diagnosis of all types of cancer to the medical management, to the surgical oncology, to the radiotherapy treatment and chemotherapy treatment of the cancer. We have also the kidney center, whether urology and urology surgery and nephrology center and dialysis center. And we receive a lot of patients who are also tourists, because when you are visiting the country from place to place, and if you are on dialysis session, you need to make sure that you can continue your dialysis in the country that visit it, especially with Dubai, with millions of visitors on yearly basis. We have ear, nose, and throat, ENT surgery, sleep medicine, a neuroscience center with all neurosurgery and neurology and psychiatry and psychology and sleep medicine and spine surgery, all of it treated under one roof. All the doctors work together as one team. They refer to each other. We have, for the complicated cases, the multidisciplinary team. So all specialties connected together, and whenever we have any complicated case, we have the medical team that they meet together and they discuss it together and they put the action plan together. طبعا dental surgery for whether maxillofacial specialty for trauma. You know, you receive many children in our emergency department with a broken tooth or jaw or all these matters that would require maxillofacial surgery. Or implantology also, cosmetic procedure for the dental and pediatric dentistry is very important because it will need general anesthesia. Other than that, of course, we have the family medicine. Actually, family medicine department is very big, and we are empowering it now and focusing about having many specialty for nationality for the doctors themselves. Because family medicine, you are coming, new family coming to any country, you need to define your family physician first, and he will help you about also for the specialized services. We have 45 nationality between the doctors, all languages spoken, Russian, German, Chinese, African languages, of course, English, French, Italian, Spanish, Arabic, all this because we want. And you know that always when the patients come, if they can't express what they feel, it might sometimes be difficult for them. So it's important for us to have really wide scope of nationality in our staff in general, whether the medical team or the admin team. We have the list of 40 translators for 50 languages that they can be available anytime to translate. Going back to what specialties also we have, I mentioned the kidney, of course, derma, ENT, ophthalmology, dental, as I said, cardiovascular, internal medicine, neurology, and gastroenterology, and rheumatology also, and pulmonology. So all the skin and allergy. Now with the current lifestyle of the stress, the smoking, the all the humidity, even there, it's all affect people with asthma, with lung problem.
Dr. Reem, now chronic diseases, they started to be younger. Could you please tell us more about the prevention programs in your hospital?
Yeah, actually currently, and this is worldwide, about focusing about prevention healthcare and preventive medicine. And unfortunately, sometimes we always remember only when we get sick. When we are healthy, we forget the hospitals. We don't want to go to hospital if we are not complaining of anything. And this is, we start little bit, it needs time to change this culture. A preventive program are very important. We have a big list of health checkup program from 6 months old till 6 years old, until 8 years old, and from only for vaccination program, and for 1 year old toddler program, for children health checkup, till diabetic health checkup, cardiologic health checkup, woman health checkup, male health checkup, and in different level, different even prices, because sometimes insurance will not cover, and patient will tell you, oh, we don't want to do it, but they don't know that if you'll do this, and you might discover, and we have so many success cases. One patient were coming for us from African country to do health checkup. The second day he was in the OT theater doing open heart surgery. We saved his life actually. Another patient were coming also to do female checkup, and we discovered for her breast cancer in early age. Many patients who will discover the pre-diabetic signs, and we can start at least guide them about the diet, the lifestyle, and many of the chronic diseases. You only need to change your lifestyle, your diet, your stress related factor, your smoking habits, and you'll not even have the diseases. So these ones we focus about it, and we try always with our marketing program to encourage people. They are not patients yet. We want to encourage them to do more. Even if you are a patient, like diabetic patients, you need to do every year test for your vision and your kidney, because these chronic diseases doesn't affect only one part. The problem that they start affecting organ by organ in your body, and as they call the silent killer. You will not feel pain, but I think yes, but they will start affecting. You will discover it by the early detection and the early test. So really, preventive medicine is very important part, and we are encouraging, and it's awareness. It's a lot of awareness program. We do it on the hospital level to encourage patients about it.
And we are also interested to know about the primary care program.
Now we have in Dubai a group of satellite clinics. So we are moving into the primary care branch of medicine by having many satellite clinics all over the city. And this satellite clinic will provide the main basic services for the communities, like family medicine, dentist, pediatrician, and derma. And this is very important for the communities, because you will have here now, the communities in Dubai, even in the other parts of the Emirates, and I can't be as a big hospital. You can build a big hospital, tertiary hospital in every neighborhood, but you can have a satellite clinic. You can have polyclinic in every neighborhood with the same standards that the hospital follow, the clinic will follow. And these doctors, their responsibility to take care of the family. In case any cases they suspect that it needs referral to the hospital, we are having referral from them on daily basis from this clinic, and also communication with the doctor here. In our satellite clinic also, we focus about the aesthetic medicine. So we have one clinic only, which is assigned for Saudi German aesthetic, SGH aesthetic, with all types of aesthetic services available there, from plastic surgery to aesthetic, to laser, to injectable, to all kinds of, beauty and taking care and wellness, mental health also very important part of taking care of us, taking care of the body and the soul and everything.
Mhm. So, and what is the on-call doctor service? Just I was thinking a lot of tourists, they come.
Yes, we have also home care service. We opened the branch of South German home care. So home care service, whether delivery of medication, delivery of your collecting of your blood samples for your test, of the family medicine and GP visits to your home to check if you have a fever, if you are coughing, if you're having any problem, or give you the injection nurse visit to your home.
For different age.
For the all the ages, and it's available. Yes, available 24/7. You'll just call. I say, okay, I can't come to the hospital. My child having a fever. The team of the doctor and the nurse will come to you. The doctor will ask for tests. They will take the blood, the collection, the blood samples. They will call for the residents and the tourists, and we have the telemedicine also. So also you can come. We can have the consultation with you through the telemedicine. You are a tourist. You will do the consultation here in the hospital, and then you will go back to your home country. So we can do the follow-up. We have a big department for international patients, actually, that they can send us their medical report. We can do with them telemedicine consultation with the doctor here. We arrange for them the visa, the transportation, the logistics, the hotel reservation, even the time of doing this, all the physical checkup, and after leaving the hospital, going back to their home country, the follow-up. We have some cancer patients that they are coming for us from Africa, and they come every 3 months because they have their chemotherapy cycle, treatments like that, and all of us is becoming in very ease. They just call the coordinator, all their booking are done, and that's it. So they are our patients for life.
Dr. Reem, nowadays nobody speaks about the energy, which is very important. How do you maintain, as a CEO of the whole group, to have the same service and quality in all the hospitals, in all the countries mentioned? In the Gulf region, in Yemen, in Egypt, in all the countries.
It's a teamwork, and it's depending also from our leadership. So patient experience is a major part for us as a group in our daily practice. Our patients, it should be satisfied always. That's why if you make a round now in the hospital, you see this golden plates that have our mobile number, my direct mobile number. Any patient can come, he will see it. And if he has any concerns, any complaint, any compliment also, they can call me directly. And they can call my chief medical officer, my chief operating officer, my chief nursing officer, and even the group chairman himself. So once the staff know that the top leadership are available 24/7, every staff also will serve the patients from their heart, because they want to be. If our CEO, she's available 24/7, I will be also available 24/7. If our CEO, she answered the patients and she listened to their complaint, I will answer the patient and will listen their complaint. If our CEO, her door is open for anyone and she's always smiling and try her best to satisfy the patient, I will do the same. We have our patients who come to us in their weakness points. They are in pain, they are tired, they have a trauma. Even their family, the mother is so worried about her child, the father is so worried about his son. We have to show them the respect and the care, and that we understand their pain. Once you guide your staff about this, okay, خلاص, you created the culture, you created the positive energy, and you created actually the healing atmosphere, healing culture. It's hospital, it's not only about doctor will come and do this and right. It's also about the healing energy, which is for the place itself. You will come inside the place, you will feel comfortable, relaxed, you feel the trust. The trust factor in healthcare is very important factor. Okay, you will go to a restaurant, you don't like the food, you leave. But you are coming here to do surgery, to do general anesthesia. If you don't trust the people that will do these procedures for you, it's a big problem. And it's our responsibility to let our patient trust us, to let our patient feel like he's within family to let our patient feel that he's taken care of. This is really the energy, as you said, positive energy and healing energy. It should come from the junior level to the upper level, and it's the responsibility of every manager. I teach my staff will teach their staff, and it should come like that, from upper down till bottom.
Discipline.
Yeah.
Like in the army.
Exactly, but with caring, caring touch.
But Allah said the best profession for a woman to be a teacher or a doctor.
Always like that, yeah. Because the passion, the caring for the woman is easier for them to express this than a male. But after a while, the male who's all doctors, we have very successful doctor and caring doctor, they know that, and they know that this is major part, because as a doctor, you become the psychologist for your patient. You don't need to be psychologist, okay? Because major part of our physical diseases, the reason are non-physical. So you'll see the cardiologist, he's listening to his patient's concerns, because these concerns are the reason for his high blood pressure, his family disputes, his problem at work, coaching, they are all of them. All the doctors, they are psychologists, and they are life coaches, and everything you want to name it. And they are friends for their patients. Yeah.
That's why the business is successful, because there is
Proper culture in place.
culture, discipline, and handwork.
Yes, alhamdulillah.
Alhamdulillah.
Thank you very much.
Thank you.
Thank you.